Better channel. I am your host, Dr. Joe, and this is the Professor John Penisarada. We got a question. How can you relieve a calf cramp within 10 seconds? Well, it happens.
It happens all the time.
I don't know if it's 10 seconds that we're going to do it, but here's what we're going to try. All I want you to do is kick your leg forward, dorsiflex that foot as far as you can, make sure that knee is locked, reach down, try to grab that toe and pull it up. Now, one of the things that it needs some type of sensory stimulation. So as you're doing that and you're stretching it out, instead of just holding it there, slap it. Slap it and slap it. The reason why, oh, damn. The reason why we want to slap it is because we're creating a different sensory response to the brain and allowing for a better control. Now, sometimes cramps don't happen because we're not drinking enough water or having enough electrolytes or potassium in the muscle. One of the reasons why it might come on is because it has no idea how to recruit an excessive amount of movement from that area. And that's the whole reason why the muscles tend to start to cramp or pull together or spasm out. So the reason why I want you guys to stretch it out and slap it is because that might allow for a little bit more control for your brain to go, all right, let's fix this cramp right now and let's recruit a little bit more muscle fiber in order to decrease the pain that we're dealing with right now.
Yep. Also helps with just releasing some of that tension, right?
Yeah.
Because that's what happens when you're cramping your calves. Your foot actually does this. It does a dorsal plantar flexion, and that muscle sometimes is fully contracted. This will help kind of like, it forces it to release, and then also gives it that stimulation of like, hey, let it go. We'll be all right.
Yeah. We call that reciprocal inhibition, right? And what we try to do is we try to utilize the opposite muscle group to help with stretching out or decreasing stimulation of the muscle that is cramping.
Yes, sir.
Right? So in this case, we're trying to utilize the anterior tib muscle to try to increase better movement there. Some of the things that you could do, if you're right next to a wall, you can even just go straight back, press back, and just lift both of your toes up. Instead of just using one side, try to use both sides and see if that might help you out. And that way, you guys can get back to walking or doing your sport, whatever it is.
Ooh.
Thanks again for joining us on another episode of the Move Better channel, you guys. Like, subscribe, share, send it to the person who's cramping right now. Get rid of cramping pain in 10 seconds. Thanks, you guys. We'll see you guys in the next episode.